This COVID-19 infection control and occupational health Listen to the Experts video series was produced by the CSIR. This video clip was produced in support of the South African National Department of Health in its fight to reduce the transmission and impact of COVID-19 on South Africa's healthcare sector.
As a healthcare worker, it is so important to take the opportunity to get the COVID-19 vaccine when you are offered one. Firstly, it doesn't just confer some individual protection based on your increased risk of becoming ill with COVID, but it can also help to make healthcare facilities safer for your patients by reducing the risk of spreading COVID-19 to your patient when you are perhaps ill and not having symptoms. Widespread vaccination campaigns also help to decrease the emergence of new variants and to help us end this COVID-19 pandemic. If you yourself are hesitant about getting the vaccine, find another health worker that you trust and talk through it with them. Some people are a bit concerned about the speed at which vaccines were developed. So let's dive into that a little bit deeper. While this COVID-19 pandemic seems very new, over the past 20 years, we've actually had two previous serious outbreaks caused by different kinds of coronaviruses in the form of the SARS outbreak and the MERS outbreak. Both of these had really worrying mortality rates ranging from 15 to 30%. So these were warning signals saying to scientists that there is a big coronavirus pandemic on its way. And so many people actually started the foundation work for developing a COVID-19 vaccine many years ago. While each vaccine has its own story about how it was developed, for the AstraZeneca vaccine that was developed at Oxford University, it was actually based on previous research in developing a vaccine against the MERS coronavirus. And so when SARS-CoV-2 came along, it really was actually quite as simple as substituting the one spike protein for this new one related to SARS-CoV and using the existing vaccine know-how to develop a vaccine against COVID-19. The next point to discuss is vaccine efficacy and safety. So looking at vaccine efficacy, the real-world data of vaccine programs have been very encouraging and have shown to make a big difference in reducing the risk of death due to COVID-19. When we look at vaccine safety, there have been signals that caused vaccine rollout programs to be stopped and then to look at safety incidents and for experts to make a recommendation whether or not that should continue. And while these pauses in vaccination programs can lead to distress and uncertainty, it is actually a signal that there is a very rigorous process behind vaccination campaigns, making sure that the safety data is there. As healthcare workers, it is also important for us to look at these safety incidents and potential side effects, like blood clotting, and make sure we contextualize that with other treatment that might have similar side effects. So, for example, when we're looking at blood clots, also comparing it to what the risk of having a blood clot is if you start another common treatment, like, for example, the oral contraceptive pill. It is also very important to tell people what to expect after they've received the COVID-19 vaccination. So, muscle aches, having a fever, having some pain around the injection site are all common side effects. But they can be very scary if you do not know to anticipate them in advance, and people might be concerned that they actually got COVID-19 disease from the vaccine. So therefore, as healthcare workers, we have an important role to make sure people know what they are in for and what to expect when receiving a COVID-19 vaccination. As healthcare worker, getting your COVID-19 vaccination will not only help to protect you, it will help to make your healthcare facilities safer, both for your colleagues and for patients who use them. It can also reduce the risk of you making your family members and loved ones ill with COVID-19. You as a healthcare worker also play a really important role in the community in answering people's questions about vaccination and being a positive influence as we try to end the COVID-19 pandemic.